In this video, I explain the following things. How facial pain, also known as trigeminal neuralgia, is related to jawbone degeneration and the methods we dentists can use to eliminate the cause of the pain. This is the next extraordinary case from my clinic. Stay tuned now. Hello, I'm dentist Dr. Johann Lechner, and I have a clinic for holistic dentistry in Munich for 40 years now. I deal with the effects of chronic toxic and chronic inflammatory distresses from the dental jaw area to the entire body. On our channel I regularly present cases that are atypical for dentists. So if you want to know what other atypical clinical pictures can be triggered in the jaw, then subscribe to my channel and have a look at other exciting cases and leave your opinion or questions in the comments. Trigeminal neuralgia is a neurologic disease of the fifth cranial nerve. Affected people tell of a flashing facial pain that lasts up to minutes and can occur up to 100 times a day. The affected people's suffering is very high. Trigeminal neuralgia is a painful disease, so bad that it is also called the suicide disease because it is the disease with the second highest suicide rate. Consequently, people are treated with medications, but there are other methods for dentists to help in cases of trigeminal neuralgia. The patient came to my clinic and described the following. Horrible facial pain in the lower jaw led me to a neurologist. Never ever I had such a pain. Speaking, swallowing, eating, the slightest movement made me freeze in pain. So I was happy to take any neuroleptic remedies. The pain became more acceptable but did not disappear. I examined the patient, and despite an inconspicuous OPG, we found a fatty degenerative osteonecrosis inside the jawbone, FDOJ. We used the cavitar ultrasound for this examination. We removed the fatty degenerative substance from the patient's jawbone in a short, minimally invasive procedure. The patient reported the first day after the surgery, the pain already felt different. It was no longer that sharp and screeching. The third day after the treatment, I had no pain at all, and I still have no pain up today. But how is the trigeminal neuralgia related to the jawbone? If wound settlements in the jawbone, for example, wisdom teeth removal or root fillings, do not heal properly, no healthy jawbone will grow back. And this bone will regress and build up cavities. In these cavities, within the jawbone, we find the inflammatory mediator RANTES or CCL5. Since other inflammatory messengers such as interleukin-6 or TNF-alpha are missing there, the affected persons often do not have any pain, and this is a silent inflammation. We sent the removed samples of the jawbone to the lab, and it contains cancellous bone with fragmented, vitally preserved cancellous parts, as well as fatty degeneration, microcysts, and small focal degeneration, but mainly fatty bone marrow. In addition, the level of inflammatory messenger RANTES was many times too high compared to the normal 150 picograms per milliliter, we found more than 5,000 picograms per milliliter in the jawbone. The jawbone might therefore trigger the trigeminal neuralgia. It must also be mentioned that FDOJ cannot be treated by medication, but FDOJ needs to be removed in a small surgery. So how can an FDOJ be recognized and localized? We find FDOJs in the jawbone and are covered by thin layers of jawbone, which is why they are missed by OPGs and DVTs, cone beams. However, ultrasound can be used to detect them. I will demonstrate this with the example of this patient. Here you can see the X-ray in area 3.8 and 3.9, but there is no conspicuous to be seen. In contrast to the cavital measurements, and the difference is very clear. Cavital shows soft jawbone in red and healthy and solid jawbone in green. And clearly cavital can measure the density of the jawbone. And clearly you can see the red color for these jawbone cavitations. For the dental colleagues among you, I would like to urgently recommend to read about which other diseases can be caused inside the jawbone marrow. You will find a link to further information in the info box. Thank you, and I am looking forward to see you again when I present the next exciting case. Yours, up to then, Dr. Johann Lechner.